Good afternoon, and thank you for joining us for today's COVID-19 media briefing. This is a Q&A about vaccine. It is being aired live on YouTube. Joining us today are DHS Deputy Secretary Julie Willems-Van Dyke and Dr. Stephanie Schauer, Division of Public Health Immunization Program Manager and part of our COVID response team. And we will begin today's briefing with remarks from Deputy Secretary Julie Willems-Van Dyke.
Well, good afternoon, and thank you for joining us today. In Wisconsin, 1,281,901 doses of COVID-19 vaccine have been administered as of today. 416,358 of those are second doses, which means all of those individuals have completed their vaccine series. Wisconsin continues to be one of the top states in the country for vaccine administration, and almost half of our 65 and over population have received at least their first dose of vaccine. Today, we are confirming that our newly eligible populations will officially be eligible on Monday, March 1st. This group of newly eligible folks is large, and we know it will take some time to get all of them connected with vaccine. However, we have also seen our federal vaccine allotment increase over the past few weeks. And the good news is we expect to see even more vaccines coming in coming weeks. This increasing supply is why it is important for us to continue to add more people into the eligible populations to avoid having vaccine wait on shelves, but instead continue our pace of getting shots in arms. Thanks to this increasing supply and to the incredible work of our vaccinators across the state, we are now at over 48% of our 65 and older population having received their first dose, and we are in a great place to open up eligibility. So let me be clear. We know that there are Wisconsinites who are currently eligible and who have not yet received their vaccine. You are still eligible. If you are 65 or older, or a frontline healthcare worker, or police and fire personnel, you are eligible, and we encourage you to get vaccinated. We are adding more groups, but you don't lose eligibility once you have it. As of Monday, we are asking our vaccinators to continue vaccinating these currently eligible populations, especially Wisconsinites age 65 and older, and to also prioritize educators within the newly eligible groups. Educators include childcare workers, K through 12 school staff, and higher education staff who interact directly with students. Following educators, the priority order of newly eligible groups are individuals enrolled in Medicaid long-term care programs, some public-facing essential workers like transit drivers and food service workers, non-frontline essential healthcare personnel like custodial staff, and residents and staff in congregate living settings. Based on the current allocation numbers, it will take about 2 months to vaccinate these groups. But with the probable authorization of the Janssen vaccine tomorrow, this timeline might be even shorter with a third vaccine when a third vaccine enters our vaccine pipeline. Local and tribal health departments are coordinating local specific plans to vaccinate K-12 education and childcare staff, and to vaccinate these priority groups, DHS will focus allocations each week on people 65 and older and educators to ensure both groups are getting vaccinated before moving on to other newly eligible populations. For folks 65 and older to get connected to a vaccinator, you can contact your local healthcare provider, your local pharmacy, your local health department, or call 211 and they will assist you in finding vaccination sites. For teachers, here is what you need to know. Every local health department is submitting a plan to us today on how they are going to be vaccinating educators in their community. Based on a review of all of these plans, DHS will create a master schedule so every local health department and school district will know when they will be receiving their vaccine to do this work. As to where educators will be vaccinated, it will vary from community to community. In some places, schools will be paired with healthcare providers. In others, they will go to a community or an on-site clinic led by a local health department, and others may work with local pharmacies to administer their vaccines. We know each community and each school district is different, and that we need different plans to address the specific needs of each community throughout our state. Remember, getting vaccinated when your turn comes is an important tool, but it is not the only way we stop the spread of COVID-19. Stay home, wash your hands frequently, wear a mask, and practice physical distancing when you do have to go out. These are still important steps we each need to take until we reach that 80% community immunity level. Thank you, and I'll turn it back to Elizabeth to answer all of your great questions today.
Thank you for that. And as a reminder, to maintain audio quality, please remain muted until it is time to ask your question. If you're on the phone and you're able to do so, use *6 to mute and to unmute. And we begin with Austin Montgomery from the Beloit Daily News. Austin Montgomery. All right, we'll try to get, Austin, are you on the line?
Can you hear me?
We can hear you, yes. Go ahead, Austin.
Okay, sorry about that. Wanted to ask specifically about the Johnson & Johnson vaccine once that becomes available. We learned today from our local health department that the state is going to be responsible for assessing where those areas around the state are most needed to send this new vaccine once it's approved and once it's been received by the state. Could you elaborate just on where the priority areas are and if there are any specific community groups or demographics that would be first in line for receiving the Johnson & Johnson vaccine when it becomes available? Thank you.
So the Johnson & Johnson vaccine is up for FDA approval tomorrow. And so I think, first of all, we trust the scientists, and we're very much looking forward to their analysis and their guidance. Once it's approved by the Food and Drug Administration, it then is sent to the Advisory Committee on Immunization Practice, who issues clinical guidelines for the vaccine and any other additional guidance to us about how we should use any vaccine. So we are eagerly awaiting that guidance from both the FDA and the ACIP. Currently, our thinking is that this is another tool in our toolbox, and we will add it into our allocation strategy along with our Moderna and Pfizer vaccine and get it out to communities across the state to expand access to vaccine, just as we did when Moderna was added to the mix. So at this point in time, I don't know that there would be any particularly targeted communities or priority groups for the vaccine. We would be waiting on any guidance from the federal government on that, but we definitely are going to put it in the mix and get it out to our vaccinators as quickly as possible. Dr. Schauer, anything you would add to that?
No, I think just one thing to keep in mind that this vaccine is a one-dose series. So unlike the Pfizer and the Moderna vaccines, which are a two-dose series, this one would be one dose, and that would be sufficient and would provide the protection. So it does have that added advantage.
Thank you for that. We go now to David Wahlberg at the Wisconsin State Journal. David.
Oh, thank you. Sorry about the delay. Public Health Madison and Dade County's plan to vaccinate educators was to do it at the Alliant Energy Center the first 2 weeks of March. Now they're saying that DHS won't give them the doses to do that until March 19th. Why did this change, and are educators here now supposed to try to get shots at Walgreens or the clinic in Janesville or their healthcare providers, or are they supposed to wait until March 19th?
So first of all, let me clarify something right off the top on this. Is no health department has been told they can't vaccinate people before March 19th. That is simply a misunderstanding, I believe, and I want to be really clear and communicate that to all of you in our local health departments that any vaccine that you have been allocated, you are welcome to give to educators as of March 1st. So let me explain a little bit more. I did in my opening remarks, but I'll make this even more clear. So if you'll recall, we've been asking people a couple weeks ahead of time how much vaccine they need for the ensuing weeks. Because we've been getting an allocation from the federal government that's a couple weeks ahead, we've been trying to pass that along to our vaccinators. And looking forward to the weeks of March 1st and 8th, back in mid-February when we asked people for those weeks, we also asked them if they had events planned for these particular groups. We were clear we were not promising them vaccine. We were simply trying to assess how many vaccine doses people were hoping to get out in those first 2 weeks. What became very clear to us, as you've heard and seen in the numbers we've given you, is we saw an escalation of the number of doses that people were asking for, nearly 400,000 doses of vaccine. And it became very clear to us that everybody thought they were going to be able to do everybody the first few weeks of March, and that, of course, simply is not feasible given the vaccine supply we have here. So we went back to the drawing board and said, how are we going to do this in a way that is fair and equitable across the state, that is manageable? And so we knew that our local health departments were meeting regularly with their school districts. We knew they had ideas and plans in place around how to do vaccination with their various school districts. As I mentioned in my opening remarks, they're different in every single community. So we asked the health departments to present, to submit plans to us. Those plans are due today. And then we will analyze the plans across the 85 local health department jurisdictions and the 425 plus school districts across the state and plot them out on a master schedule over the next 6 weeks or so about when every school district and health department will be assured they'll receive vaccine to vaccinate their educators. We felt this was the most fair way to do it and also the most planful way to do it so that clearly when everybody can't vaccinate this week, they would be able to say to their schools, this is the week we know we'll have vaccine. Now with the pending release of the Janssen vaccine, that 6-week period may compress a little bit. We may have more vaccine we can attribute to this, but as you recall, we also know we are vaccinating people 65 plus, so we couldn't take our whole vaccine supply and give it to educators because we need to keep vaccine available for people who are 65 plus. So the plan is that we continue in that 70 to 80,000 dose level going out to our vaccinators to continue to vaccinate people 65 plus, and as they finish those groups, move on to other eligible groups. And then the remainder of the difference between that and what we're seeing in an increase will be part of this distribution plan to local health departments to assure vaccination in their school districts. So this is the approach we are using for school districts. I want to reiterate, Public Health Madison-Dane County is welcome to use vaccines for educators that they receive through the normal allocation process the week of March 1st and March 8th, as our other health departments across the state. And they can factor that into the plans that they're doing and will adjust as we go along the way. So I hope that helps clarify for people what the plan is with educators. I'll just say, before we move to the next question, what I would say to our education friends, to our teachers and teachers' aides and all the staff in our school districts across the state, we're going to get you a vaccine. We cannot get every one of you a vaccine on March 1st, but you are all going to get a vaccine in the next 4 to 6 weeks, and we want to protect you, and we appreciate everything you are doing to educate our children, and it is one of the most challenging and rewarding and awesome jobs in the world, and we are going to protect you. We can only do this with the amount of vaccine that we have available, and as we get more vaccine over the next few weeks, we are prepared to accelerate this plan as need be. But just like the nurses and doctors and all who went before you, the police and fire who went before you, the people who are age 65 who went before you, everybody had to wait their turn, and you will get there, and we'll make sure you're protected.
Thank you for that. Next question to Madeline Anderson, Fox 6 in Milwaukee. Madeline.
Hi, so this week, Waukesha County's executive has sent a letter to DHS urging the state to give vaccine priority to teachers who have been teaching in the classroom over those who have been teaching virtually. My question is, what are your thoughts on this request, and is this something you will consider when you create that master schedule that you just talked about, you know, when each district will get its vaccine doses? Thank you.
Yep, I thank you for that question, and we did receive that letter, and we've had long and serious conversations about how to consider in-person education versus not in-person education and prioritization. And as a result of those long conversations, we've decided not to use that as a criteria. Part of the reason for that is, first of all, the data is hard to collect, but that's not the primary reason. The real reason is that, first of all, there is a wide continuum of how people are in school, and it is changing day by day. We know school districts who have been in hybrid models are moving to full 5-day-a-week in-person models. We know some districts are following the CDC guidance and beginning with younger children first, and then seeing how that's going and how disease activity is decreasing or not in their community, and using that as a guidepost for expanding face-to-face education with other children. And we know some schools are virtual and are planning to return to school. So I also have received letters or communication from people saying, we need our staff to be first because we haven't been in schools and we want them to be vaccinated and protected before they go back to school. So the bottom line is, as I just said, this is all going to happen within the next 4 to 6 weeks. It's a relatively short period of time in the whole history of COVID. Every teacher is going to get vaccinated. And so we'll get to all of them very quickly. And we will assure that every one of our educators is properly protected.
Thank you for that. The next question goes to Scott Bauer at the Associated Press. Scott.
Hi, thanks for doing this. Julie, can you just kind of clarify again when you say that those 65 and over will still have priority, as will teachers. So let's just say a clinic has 1 dose left and a teacher and a 65-year-old walk in at the same time. Who gets that dose?
Well, the teachers are primarily not going to be receiving doses in clinics, Scott. So I think that's not a common situation that will happen. As I mentioned earlier, we get, right now we've got an allocation of around 116,000, 120,000 doses per week. And throughout this whole last month that we've been vaccinating people 65 plus, we've been sending out about 70 to 80,000 doses a week. And we've gotten through half of the population with that allocation. So that allocation is still going out in our weekly survey to our vaccinators across the state, and we're saying, continue to focus on our 65 plus population as your primary focus with those 70 to 80,000 first doses. This is first doses, not total doses, first doses per week. And then we're taking the remainder of that, which right now is, around 30 to 40,000 doses, and we're putting that aside for teachers. And so that prioritization that you're questioning about is really happening in the upfront allocation as much as it's happening on the by person in a clinic. So that's how we're addressing this. Now, the last thing I'll say about this is we are a diverse state, and every community is achieving these goals at slightly different rates. Every community has a different percentage of people age 65. Every community has a different percentage of people age 65 who are accepting the vaccine at different rates. Some communities might be up in the 90 to 100% of their 65 plus population accepting it, where others might be in that 70 to 80%. So they'll get done at different rates. And so we're also saying to vaccinators who are part of our general survey and doing the general population, once you have finished your 65 plus population, certainly, the demand goes down from that population, certainly feel ready to start vaccinating teachers and other people in the eligible group.
Thank you for that. Let's give the next question now to Nick Bohr, WISN in Milwaukee. Nick.
Thank you for taking the call. I hate to keep focusing on this teacher issue, but I just had a follow-up question on that. You said that the districts will be getting it, won't be getting it all at once. Is there a criteria then you are using for which school districts get it first? The county executive in Waukesha mentioned the school lunch program participation. Are there factors like that weigh into that decision of who is getting it first?
Yep. So we're going to rank the districts, and we're going to use the percentage of students in free and reduced hot lunch and the percentage of students who are students of color as criteria for that. We know these are populations of students who have been, who they and their families have been disproportionately affected by this pandemic, and so we feel it's important that we get vaccine to their school districts early on, and again, very quickly, we will follow through all of the school districts. So based on those criteria, we'll get a ranking of 1 through 425 of every school district. We will do some adjustment based on geography. We will make sure that school districts across the state are receiving vaccine. Sometimes people hear those criteria and think that means only urban school children will be eligible. I can assure you from my years of working on county health rankings that that is not true, that many of the school districts in our rural areas have very high rates of children on free and reduced hot lunch. Many of the rural parts of our state experience poverty at disproportionate levels as well. And so we will assure there is distribution across the state as well. And then finally, we may do, we haven't done this yet. So part of this is when you actually look at the data, sometimes there are things that become much clearer to you. And so, for example, if we see a county where 4 of their 5 school districts are included, it may make sense to put that 5th one in, even if they're a little bit more down the list, so that a county can finish all of their school districts at one time. But we'll have to see how it all pans out once we see how the weighting criteria work and we see how much vaccine we have, which, as I know I've said to you continuously, is a changing situation every single week.
Thank you for that. Let's go now to Angelica Levito, Bloomberg News. Angelica. Angelica with Bloomberg News. All right, why don't we try Jonathan Kraus, WHBY. Jonathan, WHBY.
Have I been unmuted properly?
Yes, we can hear you.
Okay.
Go ahead. Thank you.
A lot of my questions have already been answered, but the one that I still have is, will the schedule of schools be published by DHS, or do we have to call all of the districts in our coverage area to find out where they are on the list?
Our intent is to share that list with our local health department partners.
All right, thank you for that. Let's go now to Denise Lockwood, Racine County I. Denise Lockwood.
Good afternoon. My question is about what we know so far with regards to the spread of COVID-19 among people that have already been vaccinated, and what you guys are learning from that group that has been vaccinated.
Dr. Showers, would you like to respond to that?
No, I don't have specific data to inform you. It is certainly something that the department is carefully watching and ensuring that that we are linking up when someone has been ill and their vaccination history. It's also something that is of concern at the national level, and so it is something that there will be more to come on that, but we don't have quite enough. If folks recall, we've only been vaccinating for a relatively short period of time, and so it is taking time for us to get sufficient data to be able to actually have reliable conclusions or have recognize if there is something statistically significant. So there will be more to come on that, but we don't have that information yet.
And if I can just build on that too, it's really important as we think about vaccine that, again, we remember it is one tool in the toolbox to decrease the transmission of COVID-19. And so what we're striving to do here is increase vaccine rates because that will protect more people against COVID-19. But remember, we're still at very high levels of disease transmission. So that's why at this point in time, we are asking people to continue to use the important preventive measures. So that also starts to bring the total number of cases down and the number of disease transmission down. And so these both continue to be very important strategies, along with isolation and quarantine. So if you have COVID, that you stay isolated for the appropriate period of time until your symptoms have passed. And if you've been exposed and you're not vaccinated, that you remain in quarantine so you don't develop symptoms and spread it to other people. Those elements will change in the future. I know there's been some concern lately that, public health professionals are saying you're always going to have to mask and social distance. That is not true. At some point, we will be able to loosen up all of those restrictions when we have high enough coverage of vaccine and when we've seen disease transmission come down. But it's a pairing of these things that is really important.
Thank you for that. Let's give the next question now to Rob Sussman, WTAQ in Green Bay. Rob Sussman.
Hi, thanks for taking my question. This kind of plays into what you were just talking about to some degree. You mentioned how, you're waiting for disease transmission levels to go down. My question is, at what point would those levels be considered down enough? There is some research out there right now that says, there's a chance we may not actually ever wipe out COVID-19, that the disease may become endemic instead of rather, pandemic, kind of like the flu is. At what point do we consider the transmission numbers low enough to where we can indeed, back off of the restrictions and the recommendations? Thank you.
Dr. Schauer, have you seen any literature that gives a specific number on that?
No,
I don't know that
not.
I have.
Yeah, I have not.
So, Rob, I don't have a specific number for you yet. I anticipate that CDC is studying this very closely and will be providing further guidance on that. I also know, we do our own disease monitoring here, and we have defined levels as low, medium, and high, and the state still remains in that high category. We are dropping, but we are still, I don't have the numbers right in front of me, but I think as published yesterday, we're at about 166 cases per 100,000 per week, and that I know is still too high. A low level is under 10 cases per 100,000 for 2 weeks, and so I would say once we get down to that level, we'll be in much better shape. And if it's a little bit more above that, we'll be looking to other experts to help us inform that. But what I do know is right now, we're at far too high levels to be considering that. And so it is coming. We will get, we're seeing rates come down, and the more people we vaccinate, the better those reduction of disease transmission will be. But if we can double up with good mitigation measures, we'll get there even faster.
Thank you for that. Next question to Sean Kirkby, Wisconsin Health News. Sean Kirkby.
Hi, thank you. I was wondering, the federal government announced an additional 1 million doses would be available to states this week. Does the 115 to 120,000 first dose account for the new 1 million doses, or are you guys expecting another increase in the next week or so?
No, from what I understand, Sean, we've gotten that, and that's why I'm saying 120, because we thought we had 115,000, and I think it's right around 120, 122. So we are getting those little bit of bumps every single week, and we're getting them out to our vaccinators who are getting them in arms. What I don't know is what the predictions are on Pfizer and Moderna for next week or the following week. Again, we'll see what happens with Janssen after tomorrow.
Thank you for that. Let's go now to Rob Menser, Wisconsin Public Radio. Rob, WPR. Wisconsin Public Radio.
*6 to unmute.
All right, well, why don't we try to get back to Wisconsin Public Radio. Let's go to AJ Byatt for WKOW. AJ, WKOW.
Hello, thanks for doing this call. My question would be, how has the process evolved based on what you've learned over the last month or so about what could be done to get doses directly to underserved communities, whether that be in more remote rural locations or communities of color, particularly for Black and Latino communities, where the rates are especially disproportionate in terms of the percentage of the population that has received a dose of the vaccine, and also for folks with disabilities who may also either not have a primary care physician or may not have the means of getting online or on the phone and trying to track down a dose every day.
Yeah, Dr. Schauer, would you like to start on that? And I'm happy to add on as well, too.
Certainly. So, I think there's sort of two prongs that fit this. One is access, and the other is when it comes to education and making sure that people have the information and knowledge and the desire to be vaccinated. I think to that point with the education piece, we have released a request for applications geared towards community-based organizations who will help and do outreach, and it will fund individuals in communities that have been disproportionately affected and really ensure the message and the information regarding vaccines is out there so that folks feel comfortable and have the desire to be vaccinated. That's just one example, is working with community partners. The other piece happens to be the access piece, and whether we're talking about mobile vaccination teams that local health departments can request, and so that we can find access points for vaccines that may be in non-traditional spaces or locations closer or further within those communities, rather than having them travel outside. That's a really important key piece of ensuring that we've had as many access points. To that end, we are also working on the partners with the pharmacy retail program, and ensuring that vaccine is right now in Walgreens locations, and they are doing outreach in particular to individuals 65 and older, particularly in the communities that they serve, in disproportionately affected communities, to give them a call and bring them into it. So there's many different prongs that we are working both here at DHS as well as with partners to get into the communities and not expect them to come out and reach out. So those are sort of a couple of the things that I thought of off the top of my head, and I'm sure Deputy Secretary has more to add.
Yeah, no, I think those are really critical. Also, as we've mentioned in our allocation strategy, we're assuring that we're giving 100% of the doses requested to federally qualified health centers and free clinics, and we've been hearing some really encouraging stories from those clinics about the success they're having with vaccinating their patient population. They're eager for us to open up the eligibility further to be able to expand the work they're doing. And because FQHCs are often relatively small clinics, we are also looking at ways to outreach to them to pair those mobile vaccination teams. So, you know, they may only have the space and staff to do so many vaccinations a day, but if we can add a mobile vaccination team, that often can double the number of folks that they can do in a day. In terms of the disability community, that is also a very important element of getting vaccines to people who are very much in need of them. And so, again, meeting and working with people who have disabilities and having them help us understand what is necessary. We've had the opportunity to meet with several of the committees that advise DHS on this and are taking many of the recommendations they've made to heart, especially as we designed the Wisconsin Vaccine Registry system and the call system for that. We've been working very hard on always making sure there is a telephone number as well as an online option for people to get information or to register for vaccines, so that people have both of those options available. And we're exploring with our healthcare partners and our public health partners ways that we can do, you know, you've often heard about healthcare navigators. Well, how about vaccine navigators to reach out to folks who may not know where to find a vaccine and get them information about a vaccine. Again, these are all going to be very important as we move ahead and as we have more and more vaccine. I think it'll be more and more important to make sure we're always looking for who has not yet been offered a vaccine and make sure everyone does have that offer.
Thank you for that. Next question to Ben Krumholtz, Fox 11 Green Bay. Ben at Fox 11 in Green Bay.
Hi, thank you. What is your most up-to-date forecast for when we'll reach herd immunity, 80% of Wisconsinites vaccinated?
Well, I'm very optimistic that hopefully we'll get there sometime this summer. That is always going to be dependent on vaccine supply, but we're certainly hearing encouraging news about both purchases with Pfizer and Moderna and increasing production with those companies, as well as hopefully the imminent approval of a third vaccine this week. And we know, as we've mentioned, that there's 2 additional vaccines in the pipeline. So I'm feeling more and more confident that we'll have enough vaccine to achieve that by sometime this summer. We know our vaccinators are ready. They're asking for 350,000, 400,000 vaccines a week. So if we could get that kind of vaccine supply going out there, if you just look at the simple math, we would be there by summer. And what we're going to continue to need are willing participants, people who want the vaccine. And that's why I think it's really important for us to do everything we can to reduce transmission right now while we're waiting, so that we don't have variants of COVID-19 starting to take over. We're in a race against the variants, and so getting every one of these doses out there as quickly as possible and as many people vaccinated as possible is what is going to keep that level of disease transmission low into the future. And as Rob said, yep, COVID-19 will probably be with us for years to come, but if we can keep it at a very low level like we do with other vaccine preventable diseases, we will be in a much healthier place where we can all go back to living life in a way that we did before COVID-19 hit, in a way that I know so many of us are looking forward to having the opportunity to dine out, to attend theater, to attend sporting events, to travel, to see our family without that constant worry of COVID-19. So I am hopeful it will be yet in 2021.
Thank you for that. Let's go to Gabriella Rusk, WMTV in Madison. Gabriella, WMTV.
Good afternoon. Can you all hear me?
Yes, we can.
My question, and I recognize that this is, still going to be a few weeks out, but my question is for the next wave of those eligible after teachers and educators, so I'm talking about food service and public transit workers, how is it anticipated that they will receive the shot? Is that going to be through local health departments? Is that going to be through hospital providers, or is it going to be a mix? I guess how will they get the shot once they are eligible down the road? Thank you.
Yeah, thanks for that question. And it's always important that we're looking ahead and planning for the next phase as we begin a phase. And so certainly those other groups within this eligibility group are not forgotten. We will be sure you get a vaccine too. And as we've talked about in our state, that's a strong home rule state, and that is a largely decentralized system. This is going to happen a little differently in each community. And I think that's the real value of Wisconsin, is that we have systems that build on the strengths of each local community. And it's a little bit different if you live in Eau Claire than if you live in Rhinelander, than if you live in Madison, than if you live in Milwaukee or Racine. And so I think one of the things that we will be maximizing as we move into food service workers and transit workers and utility workers is how can employers help us with thinking through how to offer these vaccines to their employees. And so we've been reaching out through WEDC and the Wisconsin Economic Development Corporation and other partners to say, employers, we'd love to have you be our partners in this. And so, again, it may be setting up an arrangement with a local clinic or a local health department for a day that employees of the certain cheese factory could get vaccinated, either at a community-based site or on-site. It may be bringing in vaccinators that normally do your flu shots and having them come on site and provide vaccine just like our normal flu campaigns. And in fact, I think that's a really good model for employers to be thinking of, because so many employers host flu shot clinics every year, and this could be a really great way to help their employees get vaccinated. So it's going, and in the meantime, it's also going to be, as people finish age 65, many people may just want to reach out to their healthcare provider and say, hey, you know, I'm a 211 or 911 operator, or I work in the food industry, or I'm a city bus driver, and their healthcare providers will be willing to vaccinate them as well. So it'll happen through all those mechanisms, but we're really, I think the biggest difference here in this group is the opportunity for employers to be actively involved.
Thank you for that. Let's go now to Eric Gunn at the Wisconsin Examiner. Eric Gunn.
Hi, thank you for including me on this call and for doing this. We've been hearing that the Johnson & Johnson vaccine's efficacy rate or effectiveness rate is something on the order of, you know, some percentage points lower than the first two vaccines that came online. I've seen numbers ranging from 66%, 72%, depending on the particular study. Now, some people, as you've no doubt heard, see those and say, gee, maybe we should just opt for the earlier vaccines. I guess I want to know, is that misguided? And how should people actually interpret the kind of data that comes out that I've just mentioned in order to understand it as it's probably most useful and most properly understood?
Dr. Schauer, I'd love to turn to you to respond to that.
Certainly. So I think one of the numbers that's important to recognize with this particular vaccine is that when it comes to preventing severe or critical disease, this vaccine is right up there with the other two. And so keeping people out of hospital and reducing deaths, that is a key consideration. In addition, this vaccine has also been shown to be effective against the South African strain, or that particular variant. And so I think if you put these things together, along with the advantage of providing, you know, protection with just one dose, and I will say for vaccinators, it's easier to store, so it does certainly have that going for it, that if someone has the opportunity to be vaccinated, that they take advantage of that opportunity and receive whatever vaccine is available. All of these authorized vaccines will be shown to be safe and effective, and they only work if you receive them, and that you're better protected to go ahead and receive the vaccine that you have there at hand than to sort of shop around and wait another month or two till you actually can find a different vaccine and get the full protection. So I think it's really important to recognize there are differences between the vaccines, but when it comes down to it, keeping you out of the hospital, reducing deaths, these are all right up there, and we're all in the same area.
Those are great points. And, you know, I will add that before we had any vaccines, if I had heard a vaccine had a 66% to a 72% effectiveness rate, I think so many experts would have been so happy to have had a vaccine that was that effective. And so this is a very good effectiveness level. I would absolutely concur with Dr. Schauer that this is about getting protected and getting protected so more of us are protected. Again, it's a race against the variants, and the quicker we do that and the quicker we bring transmission down, it doesn't really matter if your number is 70% or 90%, you'll be well protected because we've all done this together to reduce the spread of this disease.
Thank you for that. The next question now to Lane Kimball, News 3 in Madison. Lane Kimball.
Hi, yes, thanks for taking my questions. Naomi Coles. What is the timing inside of these new groups for prisoners to get vaccinated? I know that they're part of the congregate living. And also, do the DHS have conversations about changing their priority level after the Senate passed that bill that would have prevented their prioritization outside of age group?
No, we have not changed our prioritization. We had listed the prioritization of the group soon after the SDMAC made their recommendations, and to be clear, it was the SDMAC that clearly identified educators at the top of the list. And so those living in congregate settings are the last of the list, and that is where prisoners are included. And let me just remind everyone that the highest risk people in congregate settings, those who are older adults, have already been vaccinated, largely through the federal pharmacy program and other local vaccinators. So those living in nursing home, in assisted living, and other long-term care facilities have already been addressed, and that we feel congregate settings continue to be a risk. That's why they are in this additional eligibility group, but they are at the end of the prioritization.
Thank you for that. Let's give the next question now to Katie Crowther, WTMJ in Milwaukee. Katie Crowther. WTMJ in Milwaukee. All right, we'll try to get back to Katie. Let's go to Stephanie Hoff, Loose Politics. Stephanie Hoff.
Hi, thanks for taking my call today. So my question is, everyone will be out, that whole next group will be eligible on Monday. But you guys are asking that only educators and child care workers will go first. Are you going to penalize vaccinators for jumping ahead, or are you just hoping that they don't? What's the kind of where do you draw that hard line?
And we're not drawing any hard lines, Stephanie. So everyone's eligible. We're allocating our vaccine in a way to prioritize educators and people age 65 plus. We value everyone in the state to get vaccine, and we value everyone in these groups. And as I mentioned earlier, we know, again, different parts of the state are going to get to a point where they've saturated their people age 65 plus and their educators sooner than others are. And so we welcome people, moving people in those other eligible groups forward as vaccine is available. Again, we don't want vaccine wasted, and we don't want vaccine sitting on shelves. And so, we're trying to help our vaccinators and trying to be consistent across the state with this prioritization. But the most important thing is that we continue to move vaccine forward. And so there will be cases, I'm sure, next week where some of the people in those other groups will be vaccinated. And that's okay. But we just wanted to make sure that we were creating space for our older adults to continue to have a pathway to vaccination, and to getting our teachers, both those who have been in the classroom and those who are about to enter the classroom, vaccinated as quickly as possible.
Thank you for that. Let's go now with our next question. Jonathan Neisser, NBC 26 in Green Bay. John at NBC 26.
Yes, thank you for the opportunity. We're just curious, would crossing guards who help students qualify for the next round of vaccine eligibility? In Green Bay, for example, they're not on the staff of the school district.
I don't know that we've addressed that particular issue, John, but we're really saying all education staff associated with K-12 who interact with children. I'd also say, in a way, crossing guards are part of law enforcement. So I would see no reason crossing guards shouldn't be part of the eligibility group, but I don't know that anybody has asked us that question before.
All right, thank you for that. Let's go now to Josh Pagero, WBAY in Green Bay. Joshua.
Hello, thank you so much for taking my call. One of the questions I had is, in terms of, and I hate to keep beating on a dead horse, but when it comes to the plans being approved for each district and county, can you explain the process of how long that will take for an approval? I know you mentioned a day of 4 to 6 weeks, and the deadline if I recall, is tomorrow for districts in the county to submit their plans. But for each district, is it contingent on how large the district is? Like, for instance, Milwaukee approval will take longer than a rural school district out in western Wisconsin. And then also the second part of that, do you think that there might be some sort of inequity when it comes to teacher vaccinations? Like there's a district here, Shawano School District, which is getting all their teachers vaccinated today as a result of a partnership between the Stockbridge tribe. And so they're all getting vaccinated because that tribe had excess vaccination, so all the teachers are getting vaccinated. But I'm just curious, what about like school districts like in the cities, which are much more larger and don't have those partnerships? Do you feel like there might be some sort of inequity associated when it comes to that?
Well, on that question, I would go back to we want everybody to get vaccinated, okay? And so I think it's a great example where Stockbridge-Muncie has completed vaccination of their tribe and has the resources to reach out to people. They know this is the next group that is eligible, and what a great way for a sovereign nation to reach out to a neighboring school district and say, how can we help you, and move that forward. There are going to be people who go first, and there are going to be people who are last in line. There is just no way we can change that. And so what I think everybody understands is that is going to happen, and the good news is everybody's going to get vaccinated. In terms of the process for approval of the plans, we will look at all of that data. We will run our model. We will get the rankings. We will look at the vaccine supply, and we will notify the local health departments who will be in touch with their local school districts about what week that they will be assured they are going to be receiving vaccine. Now, there's going to be some shifts in that, and you're right. That's why we have to do this, because we don't want larger school districts just naturally being at the end of the line because they're too big for anybody to handle. I mean, if you think about some of our larger school districts that are 10, 15,000 employees, they'll use up a good part of weekly supply of that 30 to 40,000 vaccines. So when some of the big school districts come in the waiting model, those weeks we won't have as many districts getting vaccinated. In a different week where you have dozens and dozens of smaller or mid-sized school districts, we'll be able to address a lot more school districts in those weeks. So this is, will be a plan so they'll know when they have the vaccine supply. Most of the districts and health departments have been doing this planning for years. Dr. Schauer can tell you this is part of mass vaccination planning for a pandemic. And so they've been in touch, they have plans, they'll be ready when the vaccine comes. One of the things we also ask them is what's the earliest you can be ready? So if there are districts that weren't planning to do this until later in March, that will also be factored in, and we'll just put them in later in March rather than bumping them up earlier. So this is a multifaceted planning effort, and it demonstrates the leadership of local health departments, the partnership with local school districts, the partnership with a variety of vaccinators across the state, and the partnership with the state to be as forthcoming we can on a system to properly allocate the vaccine so everybody knows how they can move vaccines into educators' arms in a way that gets this done over the next 4 to 6 weeks.
Thank you for that. Let's give our next question now to Devi Shastri, Milwaukee Journal-Sentinel. Devi.
Hi, thank you for taking my question. Looking at higher education specifically, I've heard that some area colleges have told adjunct faculty members, some of whom do teach in person, that they can't sign up to be vaccinated, at least in the first few days of March, because the distributor that this university is working with has chosen to prioritize people who are not adjuncts. And I'm just curious, is that something that is in line with DHS's recommendations? And are there concerns that by doing this, those adjuncts will have to go elsewhere, and that could cause concerns for, I guess, capacity through the other vaccinators in our area?
Well, we cannot manage every single detail of how each district, each local health department, although that doesn't sound like those entities are involved in this case, and each vaccinator is going to organize their on-site vaccinations. What I would say is that the DHS guidance is that the vaccine is available for higher education faculty and staff who are in direct face-to-face student contact. That's what we would encourage any entity to abide by. If decisions are being made in such a way that adjunct faculty can go to a healthcare provider, to a pharmacy, can contact their local health department, and it's not going to mess up the vaccine supply. There will be supply. They may not get it the first week they ask. They may need to be put on a waiting list, but they certainly would be eligible through other providers.
Thank you for that. Next question now to Brittany Lewis, CBS 58 in Milwaukee. Brittany.
Hi, this is Rose Schmidt filling in for Brittany. I want to expand on a previous question that was asked. Can you clarify what exactly K through 12 school staff means? Does that mean only people on the payroll? Like, for example, would that extend to coaches, who are on a volunteer basis, janitors, private coaches who come into schools? Kind of where is that line? Thanks.
So K through 12 staff represent everybody who is in direct contact with students on a regular basis. And in a K through 12 school, that's pretty much everybody because the janitors are regularly in contact with students, the administration is regularly in contact with students, the coaches certainly are in contact with students. The more I think about it, the crossing guard certainly is reasonable. And so, we knew that in a school setting, everybody is interacting with the student population on a regular basis, and the guidance includes all of them.
Next question to Maddie Heim at Appleton Post Crescent. Maddie Heim.
Hi, thanks for having this call as usual. So I know that UW Health has had to reschedule a bunch of appointments again, or vaccine appointments again this weekend, and that's happened to them before. And I'm just wondering, have you worked with them or advised them on anything they could do to, change their approach to stop this from happening? Or is it sort of, there's just nothing you can do because more vaccinators are coming on and you have to spread the allocation out through all of them? Thanks.
I would suggest that it is likely the reason vaccine appointments were rescheduled this week is because some of the vaccine supply arrived later than anticipated because of weather delays across the state. So we certainly are working with our vaccinators. As I mentioned, we're trying to get the number of doses they'll be receiving out to them a week or two ahead of time, but I do know throughout the state you've seen a wide number of our vaccinators having to reschedule this week because while we were lucky enough to get all our vaccine last week, we know there were many delayed shipments across the nation, and so the domino effect of the manufacturers and the shipping companies needing to catch up on all of those things delayed our vaccine deliveries this week. So that may very well be part of what is happening there, and I know has happened to many, many vaccinators across the state. It's challenging. It's challenging to them. I know it's challenging to the people who were hoping to get their vaccine this week. We've seen it in a dip, particularly in our first dose numbers. But the vaccine will get out there, the appointments will get rescheduled, and we will all keep going.
Thank you for that. Let's go now back to Rob Menser, Wisconsin Public Radio. Rob at Wisconsin Public Radio.
Hi, thanks for giving me a second chance to work the unmute.
So this conversation shows the complexity of the logistics and decision making. I do want to ask about a group of people who will not be in the expanded eligibility group next week, which is people with chronic conditions, some of whom might be really at quite high risk if they were to contract the virus. Can you say a bit about the decision that Wisconsin made not to prioritize those who have chronic conditions? And is there any chance that the state would revisit that decision as supplies ramp up?
Yeah. So as the State Disaster Medical Advisory Committee did their deliberations, they looked at a number of different factors. One was the risk of disease and really the risk of death that certain population groups faced. And that certainly is why people over age 65 were included in the recommendations. 87% of the deaths in our state have been in people over age 65. And so that risk of mortality was very high in their deliberations. But then they also considered risk of exposure and what groups also posed risk of exposure and risk of spreading to other people. And so it was a balancing of those criteria that led them to, people in congregate settings and people who were older being the most prioritized groups based on mortality, and the current, the first groups, healthcare workers, and these additional groups like educators, food chain workers, transit workers, utility workers, all public-facing professions that were prioritized because of the risk of exposure and where they stood in transmission networks that they could, disease transmission, not electrical transmission, that could spread to others. And so certainly people who are age 64 and under with chronic conditions are another group at risk, and that is a group that is certainly under consideration for a subsequent phase. And we're not changing this phase at this point in time, but I do think vaccine supply will certainly influence when we may be able to open up the next phase. And hopefully with increased vaccine supply, we'll be looking at that next phase even sooner than we might have anticipated a few weeks ago.
Thank you for that. And we have one last call for TMJ4 in Milwaukee. Katie at TMJ4 in Milwaukee. All right, well, with that, we will wrap up today's briefing. We want to thank the Deputy Secretary and Dr. Schauer and all of you for participating. We ask you to continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.